I'm excited to announce that the second part of our program today is headed by Kimberly Leonard. She is a senior healthcare reporter at the Washington Examiner. She has extensively covered paid family leave. I rely on a lot of her coverage to understand what's going on and see the landscape. So thank you all for being here. Pardon me.
Hi. Okay, we're all seated.
Thank you, Mike.
Everything's set. So the next part of the program, we'll be talking a lot about how families benefit from spending time together and from some of these leave policies. We've talked a lot about the political aspects of this, and we haven't really been able to touch on the science behind why this is valuable to families. And so I'm really looking forward to hearing about that, because I'm often on the Hill reporting the politics and attending hearings and things like that. So it'll be really interesting for me, and we're going to have each of our panelists sort of give a brief introduction and then jump in for questions. And are we also taking questions from the audience? I think that we are. Okay, great. All right, so right here on our panel, I'm just going to move from left to right. We have Myra Jones-Taylor, Chief Policy Officer at 0 to 3. Your organization is devoted to making sure babies have a strong start in life. And then Jennifer Greenfield, a professor at the University of Denver who advocates for paid family leave. And then Walter Gilliam, a child psychology and psychiatry professor at Yale. Thank you all for joining us today. Myra, let's start with you. Can you tell us a little bit about some of the things that you're working on?
Yeah. So first, I would love to thank the Bipartisan Policy Center for hosting this forum on really what is one of the most important policy issues facing American families today. We have come a long way since the Family Medical Leave Act was passed 25 years ago, from having to make the case, as we heard earlier, make the case for this policy, for actually now having bipartisan policy discussions. So I'm grateful for that. I would like to start off my comments just by sharing the story of the Simmons family, which is a family I got to know back in May at the Strolling Thunder event, which is part of Think Babies, which is 0 to 3's national campaign to get policymakers here in D.C. and in state houses across the country to think babies and enact policies that will, as you said, create strong starts for all children in this country. The family came from Minnesota. It was the Simmons family, Hannah and her husband Marty and her two beautiful boys, big blonde hair and blue-eyed boys, beautiful boys. And they lived just outside of Minnesota, outside of the Twin Cities in Minnesota. Hannah's pregnancy with her second son was uneventful. The delivery was uneventful until about 30 seconds after he was born, and he was struggling to take a breath. And they later found that he had a congenital heart defect and would require open heart surgery the very next day, before he could even turn 24 hours old. Thankfully, Grayson was the boy, he got out of surgery well and he recovered well. But as he improved, Hannah really struggled. She had to manage all of this so quickly. Everything happened so quickly. She couldn't process what was happening, and she had to be in two places at the same time, be there for her toddler, be there for her infant, and all trying to manage her family. She had just been laid off in a restructuring from her senior management level position 6 weeks before her son was born, and was now trying to grapple with all of these things that were happening. Her husband, Marty, thankfully was able to take leave from his job. He was an agricultural mechanic, but all of that time, he took 4 weeks off, was all unpaid. And so as Grayson continued to improve, she was managing the mounting medical bills. Was she going to get a job? What was that job going to allow her to do? Would it allow her to take care of Grayson and their older son, Dane? And she started to really suffer. And on her 6th week postpartum visit, she was diagnosed with anxiety and postpartum depression. She reached out for mental health services and was later also diagnosed with PTSD. We know that paid family medical leave would have had a significant positive impact in the lives of the Simmons family. And we know this to be true across the country. When we think about these policies, it's pretty easy to think about the complex needs of all these families, but these are real issues that policymakers can have an impact on right away. They were lucky, the Simmons family was lucky to have savings. but those savings were depleted within weeks. We know that many families are at the edge of financial crisis and need paid family leave, need at least 12 weeks of paid family leave. So we know this is good economically. We know this is very good for the social emotional development of young children. We know that the science tells us very clearly, and this is why 0 to 3 does what we do, that we need to make sure that strong bonds are formed and that attachment happens between parents and babies at the very beginning. I was so happy to hear Senator Santorum talk about that. That is also a long time coming to have Republicans and Democrats, anybody talking about that, so that was great. We know that that needs to happen, and it happens over time, and which is another reason why it's so important to have paid family leave. The other thing I want to stress before passing over to my colleagues here is that we need comprehensive paid family and medical leave. We know that the Simmons family would have benefited not only from time off right after the baby was born, but also to make sure that Grayson had a parent who wasn't stressed out managing, what am I going to do? Am I going to lose my job if I go and take you to your doctor's appointment? We need to make sure that parents have the time and the resources to take care of their children in the event of an illness, of their own illness in the case of Hannah, or a loved one. We have come a long way. This is good news, but we still have to now work out all the dirty, I wouldn't say the dirty, but where all the work happens. It is an exciting time for us here in this country, but as you heard Senator Santorum say, we are facing unprecedented declines in the birth rate. And we know the reason why families, young adults, aren't having children or are having fewer children, they're certainly not having 7, or even 4 as much, God bless you, is because of 2 things: the high cost of childcare and the unavailability of paid family and medical leave. So I'm so happy that we're having this conversation, and so happy to be here and share what we're doing on the Hill and across the country to make sure this happens for everyone. Thank you.
Yes, thank you. And Jennifer, I understand you have a personal story to share, if you'd be willing to do that with our audience.
Sure. So I also want to echo the thanks to the Bipartisan Policy Center for convening this conversation. And it's thrilling to hear Ivanka Trump say, we know that paid family leave is just good policy. And so I'm happy to share my thoughts on it. I'd actually come to the issue because I was studying how caregiving for older adults impacts a caregiver's own ability to save for their retirement, for their own long-term care needs, really impacting not just the short-term household economic security, but long-term economic security as well. And then I suddenly found myself thrust into a caregiving role myself. I was pregnant with twins, and the twins, as they often do, decided to come early. And so there I was, suddenly a new mom with 2 medically fragile babies in the neonatal intensive care unit, or NICU. Thankfully, through my employer, I had paid leave. The nurses kept telling me all the science that Dr. Gilliam will share about why it was so important for me to be there, holding my babies as many hours as I possibly could to support their health and developmental outcomes. And then I was looking around, getting in conversations with the other moms and realizing they were ducking in for a half hour before running off to work. They were trying desperately to drop off breast milk that they had pumped at work so that their baby would have food for the next few hours while they couldn't be there. They were trying to catch up on sleep because they were managing work and managing these medically fragile infants. And all the while, I knew that their baby's health was being impacted by their absence. And so this made me have a whole new perspective on the issue, and realizing that caregiving, 1 in 10 babies in the United States is born early and has some NICU stay. And this is an issue that comes up at that moment of having the newborn, but then extends, and we often have a caregiving episode later in life where we're caring for, the baby with pediatric cancer, or the spouse with an issue, or an aging parent. And each time there's a hit on our household economic stability. So I started doing research. Once you're a researcher, you're always a researcher. So I'm sitting there by the crib side of my kids and thinking up research questions, translated into a study where we're now actually interviewing mothers in 4 hospitals along Colorado's Front Range to understand what access to leave do they have, unpaid or paid, what household income and those kinds of things, and how is that related to their infants' health outcomes and developmental outcomes later on. I'm also continuing continuing the research looking at how caregiving for older adults impacts household economic security as well, and really trying to think of that as a continuum, knowing that this is something that occurs across the life course.
And I understand you have some early findings to share with us, which we can get back to if you'd like.
Okay, great.
So, Professor, tell us a little bit about, I think that when people think about paid family leave and things like that, they don't necessarily think about, all the things that you're working on, at least here in Washington, having to do, with actual childhood development, psychology, and all that. So can you tell us a little bit about some of what you found?
Sure. And I'm glad that we're talking about the babies. because it is about babies too. It's about what's good for parents, and it's about what's good for babies, and it's impossible to do what's right for babies without doing what's right for the adults that have an important role in their life. Babies are born hardwired to form strong human connections with someone who's going to be there for them, to be there to protect them, to be there to nurture them. They are hardwired for this. When a baby is born, they have a fairly limited range of vision. They can only see things about 7 to 12 inches away from their face. Anything much closer than 7 inches is too close, too fuzzy. They can't really see it. Anything much farther than about 12 inches, too fuzzy. They can't really see it. 7 to 12 inches, about right here, or about right here. That's 7 to 12 inches. Babies are born with a range of vision designed that this is their world right here. And it takes several weeks for that to actually change. For several weeks in the life of a baby, their whole world is right here. If you were to take a baby, and a newborn baby, 1, 2, 3 days old, and show the baby pictures, and the baby can turn their head to preference one picture or the other. And say, for instance, you had a picture of a face, or you showed the baby a picture of a car. Which way will the baby turn her head? Every time towards the face. What if it's a picture of a face or a Mercedes? Every time towards the face. How about a circle or a square? The circle, because it looks more like a face. They are wired to seek us out. And it stays like that for quite some time because that's what they're designed to do. Babies, when they're born, they know the scent of their mother. You can put a tissue next to one side of them or the other side, one scented with their mother, one scented with a different woman. They'll turn to the one that's scented with their mother. They know the sound of their mother's voice. If they've heard their father's voice in utero, they know the sound of their father's voice. They are hardwired to be connected to us. And in the course of giving birth, we become rewired too to connect back to them, to reciprocate to them. There's a hormone called oxytocin, which some of you may have heard about. It's powerful. It is a hormone that's designed to make you fall in love. To make you fall in love with whoever it is that you see, to cuddle. It spikes up when we form romantic relationships, and it also spikes during childbirth. As a matter of fact, it's so powerful that there's a synthetic version of it, Pitocin, that we use in order to stimulate labor. This is nature's love potion, and it is naturally inside of us, and it spikes up during the birth of a baby, designed specifically to cause you to fall in love with and want to protect that child. And interestingly enough, even though oxytocin levels are different in the brains of men as it is opposed to women, it also spikes in the brain of a man if the man was there to witness the birth. A spike in that oxytocin designed specifically to make him fall in love with whoever it is that he's seeing there, that mother and that baby, and want to be there and want to protect them. This is powerful, powerful stuff. Babies are hardwired to seek out and form human relationships with us, and their skill set is set to where for the next several weeks, for the next several months, they're basically forming those relationships. That's what's incredibly important to the baby, and it's incredibly important to us too, as adults, as parents. Whether you believe that it's in there due to evolution or nature or intelligent design, it is in there. And it is in there very hard and very strong. And if anything has taught me about how science is in terms of human development, it's this. Anything that's that hardwired into us, you have to respect. You have to pay attention to it, and when you don't pay attention to it, it has significant ramifications.
When you look at the policies around paid family leave, they often focus on that 12-week period. What do we know about that for parents and for their infants? What does the research tell us, or any of you can answer that? Yeah.
I'm glad to jump back in, but I just spoke. But I mean, one of the things that we know is that, and this is also based on a consensus report from a report called Caring for Our Children, which was a consensus report of pediatricians and child psychologists and developmentalists, that the first 3 months of life is very important for babies for a lot of other reasons too. It's a time when they're learning a lot of really important things, like how to maintain their body temperature. For 9 months, they've had that maintained for them by someone else. And now they have to learn, how do I maintain my body temperature? How do I manage sleep-wake cycles? And that's an important set of work for them to do for the first 3 months. And it's also important for them to be able to develop their immune system so that they can actually be in more public kinds of settings, which is why that consensus report says that it's really not safe for that baby to be in child care outside of the home for the first 3 months of life. You know, and so the first 3 months of life, that's a sacred time. It's a sacred time in terms of that baby being able to learn how to be a human outside of the utero, and it's an important time for that baby and for that parent to learn how to be in a solid relationship.
And I do want to say, too, that the 12-week mark is actually more of a compromise. And there are a number of countries around the world that offer a much longer leave. And we have some good evidence from those places that show that the longer leave actually does have positive health outcomes for both the babies and the parents. The other thing about having a longer leave is that it allows even more time for the parents to share responsibility to both learn how to be caregivers for those newborns. And then lastly, we know that there are a number of companies around the country that are already innovating in that area in the United States and extending leave 16 weeks or even 6 months and beyond. And we are seeing that that kind of a length of time does have benefits in reducing healthcare costs, in improving outcomes for the babies and the moms, addressing things like postpartum depression and anxiety, which sometimes don't manifest until a little bit later than that three-month mark. And then again, getting back to the NICU issue, that we do have so many babies that end up hospitalized for a period of time. One of my research partners actually emailed me yesterday. She had had a conversation with one of the moms we're interviewing and thought that the quote was really helpful. The mother was really grateful to her employer because the employer was allowing her to work at the hospital so that she could save her leave for when the baby came home. And so this is a mom who just gave birth to a medically fragile preterm infant. She's recovering from that birth experience herself, and there she is with her laptop, right? And incredibly grateful that she could do that because then she'll still have time for those first regular full-term months at home that we, have a lot of science about that say that are so important. She also was grateful because she's going to be allowed to borrow her vacation time for next year. So borrow it ahead of time in order to add on a couple more weeks. What happens when the baby starts at daycare and gets sick? Which happens, right? And so, these are the issues that families are encountering. And, I want to argue that 12-week mark is really kind of a minimum, and that we, ideally, I would hope that we would be talking about an even longer time.
And I would add, we heard from Ivanka Trump saying that 25%, and then later Senator Dodd, 25% of American women right now are going back after 10 days after the birth. Where are they taking those children? Where are they taking their babies? Most states have regulations that will say that the youngest age of a child who can enter childcare, a licensed childcare, is 6 weeks. So this means that either that child is being there's cobbled together care, which is not great for attachment. That whole 7 to 12 range is really important to be consistent. 7 to 12 inch range is consistent care, the same few faces. You don't want to have multiple faces. We also know that unfortunately, if a caregiver is providing care for a child at 10 to 12 days, 10 to 14 days, that is most likely unregulated care because there's not a state that will regulate that. So we don't know about the quality of that care. So while I agree that 12 weeks has really been a compromise, we know that children are entering care very young, and the quality of that care is all over the map, and I would say it's mainly placed in the side of the map that's not that high quality. So it's really a problem.
Now, a few states do have mandated paid family leave through payroll taxes, and I believe that you've done some studies on that too. What have we been able to learn kind of from these state innovative approaches and how they would apply across the country? And there is a bill in Congress that has Democratic support that would kind of create a national plan, but right now they don't quite have the votes for it, it seemed from the hearing that I attended last week. What can you tell us about what we've learned from these state policies?
Well, I could talk about it from the child perspective, in that we know that when states have instituted paid family leave, there are higher rates of breastfeeding, for example. So we know in New Jersey, families, low-income women actually, who took advantage of the state paid family leave were more likely to remain breastfeeding, to breastfeed for a month longer than their counterparts who did not take advantage of paid family leave. That's huge. We know that breastfeeding is a critical component of the mother's healthy recovery. It's also a critical component of healthy attachment, and then it has lifelong positive health benefits. We also know that there have been some studies that show that families who take advantage of paid family leave, the children are actually less likely to have disruptive behaviors and show signs of, actually it's the reverse, and I'm looking at the two researchers here, so I'm thinking, oh, I got to get this right. It's the reverse.
We'll correct.
I know you will. I know you will, Walter. It's actually so for families that have not had access to paid family leave, there's been one study at least that shows that children they exhibit behavior problems and lower reading abilities by the time they're age 3 or 4. So that's the reverse. But the states that are doing well, positive health benefits. We also see more attachment to the workforce, again, for mothers, lessen signs of postpartum disorder. So there's some good things that are coming out of states.
Right. And a lot of these states also provide the medical leave side, which we can talk about a little bit. Jennifer, with your research, dealing with caregiving, because a lot of times it's caring for a parent, another family member, a spouse maybe, oneself even. Right. But I know that you have done research in the area of looking at care for older adults. Mm-hmm. Are you able to shed some light on some of these state policies in that area?
Sure. So, one of the things that we know even from the FMLA policy is that 55% of people who took FMLA did so to care for their own medical issue, mm-hmm. And then almost equal parts took FMLA to care for a newborn or bond with an adopted child, or to do caregiving for a significant family member who is older than a newborn. And we know that in states where they offer paid leave, for instance, in California, which has the longest running paid leave program at the state level, that there is a really significant positive impact in terms of workforce attachment, both for those who took that bonding parenting leave and for those who did the caring type of leave. And so they're more likely to return to work. They're more likely to have higher wages 9 or 12 months later. And that has really significant ripple effects for that family down the road. And so if they know they can come back to work, they know that they're going to have the wages that they need down the road to be able to support their family. They're contributing to their retirement savings, Social Security or others. Mm-hmm. But the other thing about that is that they have stronger loyalty to their employers. So it's not just that they're going to be in the workforce, but they actually are more likely to return to that employer. And so the businesses have reported that paid leave has either a positive impact on their business or a net neutral effect on their business. There's no negative impact because they're reducing their turnover costs. They're not having to rehire workers, train workers, and they're also seeing increased productivity from those workers because there's less absenteeism, but there's also less what they call presenteeism, which is where you're at work but you're distracted. We all know what it's like to get stuck on hold with an insurance company or trying to juggle managing the care of your loved one, and so there's less of that going on because the workers are able to take that paid leave. So employers really do benefit from it as well, and there's overwhelming evidence of that from the state level policies.
Now, because it's done through the payroll tax, do a lot of employers tend to hire someone to fill that time, do we know?
You know, it's interesting. I've testified on this issue at the Colorado legislature, and often there are businesses there that testify about it as well. And what they are reporting is that there's actually a number of different strategies that they can use. And one of the reasons that it helps to have a policy that's kind of spread broadly, where there's a broad risk pool, is that employers don't have to pay a ton of money into it, which means that they have a little bit of money left aside so that they're not paying the salary of the worker who's taking leave, and they're able to pay a salary for a replacement employee, or they can pay for overtime or time compensation for people at that workplace who just fill in rather than hiring a temp.
Right. Now, obviously, during this time off with a new child, a lot of the time can probably be used to see what will happen next in terms of childcare, or whether they're going to switch off to doing paternal leave or something like that. Walter, can you speak a little bit to that, to the use of leave in preparing for that capacity?
Sure.
And the change.
Well, we would certainly hope that the time that a parent is able to spend with their child after the birth of the child is going to be time well spent, and that parent is going to be able to devote attention and love and care to that baby, and then be able to form that strong relationship. But there's a lot of other things, like you're mentioning, that also have to happen. If they're going to go back to work, like you're saying, Dr. Greenfield, they're going to have to have a child care arrangement in place, and that child care arrangement could be a child care center, it could be family, friends, and neighbor, it could be something, but they have to have that already planned out, and that'll take a little bit of time too. And then what we would really hope is that we would hope that that's not going to be an abrupt kind of transition, that the parent isn't going to be with their child for 12 weeks, and then all of a sudden they just go to some provider someplace and then drop their baby off. I mean, what would be ideal would be for this parent to be able to form a strong relationship with their baby, and then during the course of that time, have a sense of where this next paid provider is going to be, and then be able to use that time to actually facilitate a warm transition over to that baby, to that provider. When you have a newborn baby, and I say I have a baby here, and we see the stranger, and then the baby sees the stranger, what does the baby do immediately? Baby turns to the caregiver, turns to mom, turns to dad. What kind of expression do I have on my face when I'm looking at you? And that's how that baby knows whether that person's safe. If the baby's first experience with that caregiver is going to be at a day when the parent and that caregiver have never met before, and mom is scared to death because this is going to be the first time I'm going to drop my baby off with somebody that I don't really know very well, that's not going to be a good transition. It's not going to be good for the baby. It's not going to be good for anybody. And so what I would really hope is that it's going to be time well spent, and perhaps even taking advantage of things like child care resource and referral agencies that already exist in our country, and they're basically there in order to provide child care assistance and to provide information for parents. And we could certainly make child care resource and referral agencies, I would think, a major partner in family leave in order to be able to help parents be able to use those weeks and months that they would have with their baby to best advantage.
Myra, is there anything that states or the federal government can do, or maybe there are bills that we're unaware of, that would improve support for child care, early education, that we need to be thinking about or watching out for?
Well, we had a historic win when it comes to child care this year with the historic increase in the Child Care Development Block Grant, which Ivanka Trump spoke about earlier today. That is huge. That is the, as we heard, that is the subsidy, that is the resources that states can give to parents to offset the incredibly high cost of child care. But it's also something that CCDBG is also used to improve quality. So there is also an infant toddler set aside, which is really important because we know, unfortunately, there's a dearth of care for infants and toddlers. In the state where I was formerly the Commissioner of Early Childhood, the state of Connecticut, we had one licensed child care spot for every 9 infants and toddlers who needed them. So when we're talking about the paid family leave, we really see child care as paid family leave, child care as part of a continuum of services and policies that we want for families. Also, Early Head Start is a phenomenal, high-quality child care program, high-quality care for young children, comprehensive wraparound care for young children. We also got a nice increase there. So there are things that are moving. It's really important to know there good things did come out of this omnibus. So that was really great news. But we are still not all the way there. We know that still the lion's share of families who are eligible for child care and development block grant, for example, are still not receiving that care, especially infants and toddlers. We know that the lion's share of children who are eligible for early Head Start will never get it with this funding. And so we have made strides, but we are very far away. And so at a time when in our country we can afford a significant tax cut for many people, people who make incomes like myself and much higher, I would hope that we could also find the resources to provide resources that are truly, truly going to make a difference and a positive impact for every family in this country.
Yeah. Do we have any audience questions? If y'all can feel free to bring them up, but I have more questions, of course. Both of you have studied race disparities and how it's affected this area. I'd like to hear a little bit about some of what you've found, in particular, in regards to some of the differences that you see, whether in certain states or regions and places like that.
So one thing, I was thrilled to hear Ivanka Trump talk about how while 15% of workers across the U.S. have access to some kind of paid leave, it's only 6% when we look at the lower income spectrum. Mm-hmm. And unfortunately, those who are most likely to experience a preterm birth, for instance, are African Americans are twice as likely to experience preterm birth or low birth weight birth than a white mom, for instance, are then less likely to have access to paid leave. Yeah. And so it compounds an existing health disparity when then the mom doesn't have the ability to take the time off of work. We've just been trying to crunch numbers with our pilot data from my Nicu study, and unfortunately what we're finding is our median for number of days of paid leave for the moms in our study is currently 0. Which means that more than 50% of moms in our study have no paid leave at all. And it's less than 25% that have 30 days or more. And so access to leave is something that is becoming unfortunately, it's fairly common experience, but it's far more likely among the households that really need that income replacement the most. And it's also far more likely among those who are already historically marginalized and underserved by our healthcare system. Mm-hmm.
And not to mention maternal mortality rates, which is another issue that Congress is addressing now. Right. When it comes down to what's being talked about on Capitol Hill, I understand the House is going to start talking about it too, mm-hmm. And they at least want to start tracking what exactly is behind such high maternal mortality, and it's probably something that they'll end up finding mm-hmm. is a contributing factor.
Well, actually, there is research that shows that there is a significant decline as well in infant mortality when you have paid family leave options for families. And we know, of course, that as Ivanka Trump mentioned, that we are the only industrialized nation that has an increase in SIDS. We are also have the unfortunate distinction of being an industrialized nation that is seeing the increase of infant mortality and maternal mortality, and that's disproportionately represented among women of color, African American women. And so when we talk about these disparities, making sure that we have paid family leave that is for women of all socioeconomic levels and racial backgrounds.
Mm-hmm. And this was actually going to be my next question, so whoever wrote it, thank you. What do we know about the importance of paternity leave or father-infant connection? If a dad has time to be, sorry, whoever wrote this. Are there health impacts if a dad has time to be there after birth? Who can address that question? You sort of talked about that a little at the beginning.
Yes, everybody's looking to the man on the stage. Fathers are important, and I think that's something that most every American can agree on. Fathers are important, and it's important to have a strong father in the life of a child if such a person is available. It's also important to have anyone who's going to be part of that nuclear family that's there to be able to have that kind of a strong relationship. I'm sitting here answering a question about father involvement, and I'm facing straight in that direction, where I've been watching a father hold his child's hand the entire time that we've been sitting here on the stage. And so I'm sitting here answering this question with like a clear visual inspiration right in front of me. So thank you both for that. We do know that when a father can be around with the newborn baby and with the mom, that it helps to form a stronger relationship between that father and that child, but also that father and that mother. And that relationship is going to be an important one, and it's going to be a lasting one. And so anything that we can potentially do through government, through business, through any other private means, that helps to strengthen that little family unit between those caring adults, male or female, and that baby is going to be good for the family, and it's going to be good for society, and it's going to be good for all of us. That's pretty much what the science tells us.
So I wanted to share two things, one of which is that the current study that my team is doing in NICUs is only interviewing mothers for purposes of sorting out confounding issues. But we have just completed a review of literature on parental engagement in infants in the NICU, and there are several studies that look at impacts of fathers engaged in NICU infant care and show that there are decreased levels of depression, anxiety, and all, many of those mental health benefits that mothers have, fathers also experience when they're able to be present in the NICU. The other thing I want to say is that this is actually a really under-researched area, and I think that we need to be putting some resources into understanding this better. I know that in other parts of the world, here we're struggling to put in place any kind of paid leave program. In other parts of the world, what they're trying to figure out is what's the right balance. How do we incentivize fathers to take the leave that they're allocated in places where it's left up to the couple to decide? Often it ends up being the moms who take the leave, and then this results in income disparities down the road for those mothers. And so figuring out how to create the right balance, whether it's mandating that dads have to take some of the leave and moms have to take some, or should they be taking leave together at some point? Those are the questions that they're experimenting with in other parts of the country, and I'm really looking forward to those answers.
Do we have any data on how often men take parental leave, or how many companies offer it, or any of that?
So in California, the paid leave program resulted in more dads taking leave, and this was one of the really important outcomes. And they weren't sure whether that would be true, but when paid leave is available, dads are far more likely to take advantage of it. So I think that that's one of the strong arguments for making any kind of national paid leave program that we adopt available to both partners if there are two partners in the household.
Mm-hmm.
It's a great point, because when it's not available to fathers, the number will be zero.
That's right.
Absolutely. But I'd like to add one other thing to what you were saying before, when you were saying that, while we're still struggling in America to try to figure out how to make paid leave happen, other countries are figuring out, the details of it. Mm-hmm. I would say that there's another thing, too, in some of the work that I've been doing in other countries, too, that's happening in other countries. Other countries are also spending their time wondering, what's wrong with America that it doesn't already have this? And so when I go to the other countries and I talk about, some of the issues regarding infant care with really young children, they say that's a concern, because in China we get to be with our babies for the first 100 days paid, and then we can have extended time over and above that. And so I would add that a lot of the other things that countries are worrying about, other than the United States, is what's up with us.
Well, I was thinking as well that with same-sex couples, if that's not an available option, then how do they work that out as well? So it can probably be discriminatory in that way. And then that also kind of leads into, I guess, this next question about adoption, a topic very interesting to me. My father was adopted. And what does the science say about the time adoptive parents and kids need to acclimate?
I honestly, I'm going to look to you. I don't know. I can say this, though, that we know that families who take leave after an adoption form strong attachments, form strong bonds with their babies in the same way that a biologically a biological child would. I was raised by my stepfather, and he was the most important person in my life. So I would say, the same thing happens, but I don't know if you want to speak more scientifically than that, Walter.
I don't know how scientifically this is going to be, but I mean, one of the things that we just know just in general, whether you're talking about biological birth, whether you're talking about adoption, foster caring, whatever it is, when you're bringing a new person into your family, that's an important time. And it takes time to be able to negotiate exactly what does this mean, how do we understand each other, how do I regard you, for you to be able to form a strong connection with me, for me to be able to form a strong connection with you too, and that's based on trust. And that trust takes some time to establish, and that's going to be the case if that baby is born biologically into the family, if that baby is adopted into the family, if that baby is foster cared into the family, because in the end, regardless of how that baby arrives to us or how that young child arrives to us, it's all about forming human connections.
The other thing I'll say is that babies or children who are adopted, especially if they're adopted at later ages, are often coming from a background that involves some kind of trauma or neglect. And in those situations, it's critically important for that trust to be formed with the primary caregiver. And that's something that requires time. It requires face time. And then once trust is established, that is often actually one of the most challenging times, because then the child is finally free to actually misbehave, to test boundaries, to do all of those things that kids do. And it's really important for the primary caregivers to be there for that part as well, and to not be at that point off at work now, just when the child has grown comfortable. And so it's critically important for adoptive parents to have that time to build those relationships, to weather the first few storms with their child, to develop that deep bond that will help them carry through. And there was something else I was going to say, and it's gone out of my head, so I'll wait.
Maybe what else you were going to say was that the other thing, too, is we don't want to disincentivize adoption.
Right.
I mean, why would we want to be able to have a policy that's in place for you to be able to form a strong relationship to your child if your child is born biologically into you, but we're going to disincentivize you if you adopt?
Right.
And so adoption is very important. It's important for us to be able to give all of our children, especially those children who have gone through lots of trauma, some kind of a stable home environment, and we want to incentivize it, not disincentivize it.
And you actually reminded me what I was going to say also. That, thank you so much. I appreciate it. There's logistics that have to be managed. I have a colleague at DU who recently got the call, there's a baby on the way, and you have to drop everything. You can plan to adopt for a long time, but you never know exactly when it's going to happen. And so at that point, and I've had a number of friends, or people that I work with in volunteer settings as well, who suddenly are taking in an infant or two or an older child, and they don't have the clothes they need, they don't have a crib, they don't have all the infrastructure that kids require. And so needing, parents also often need that time to be able to make the phone calls, set up those doctor visits, set up all of the stuff that comes along with having a new kid.
Right. Myra, were you going to add something on that? No. Okay. One of the questions we have here, and something that we talked about a little bit on our phone call, has to do with childhood illnesses after paid family leave. One of the things I have covered a lot as well in my capacity as a reporter, just all of the appointments that parents have to get done as soon as they have a baby, whether it's vaccinations or checkups, and they happen, so many times over the course of the year after birth, and then over the course of their lives, of course. Can you talk about some of the ways that paid family leave policy can help improve wellness for a child in terms of doctor visits or better health outcomes then as a result?
So we know that babies between, I think it's the first 3 years, have more than a dozen well baby visits. That's just to make sure that the babies are getting vaccinated, that they're getting the support that they need to be on a healthy trajectory. We also know, unfortunately, that there will be some children, there are children who suffer significant, major childhood illnesses. We know that childhood cancer, for example, is on the rise. Over the last 20 years, there has been a steady increase in childhood cancer, and those are concentrated in early childhood. And the severe, really intensive forms of cancer are often experienced by children before the age of 1. It is critical that a parent be able to take time off to be with a child who is going through really horrific medical treatments. And for the parent to be able to feel that they are doing their job as a parent, to care for a child at their greatest hours of need. And so we know that while it's really important to have this time, to have paid family leave happen at the beginning of a child's birth, we also want to make sure that it is available later on in life for those horrible and unforeseen situations. We know, for example, we don't want to have a disparity between co-workers who are working side by side, where you have a parent who's been able to take off with a joyous occasion of a new birth or adoption, and then have a coworker who's just down the hall or in the next cubicle who has a child who is suffering from cancer and cannot take off to be with that child and is rushing straight from work to the hospital to be with the baby, or taking off unpaid time that is going to have a significant economic impact on that family. So we know that it's important across the life trajectory. I haven't even spoken about elder care. Ivanka spoke about, being that sandwich generation. That is also a critical component of just being able to be an American, a human being in society, and care for families across the lifespan.
And I think it's important to recognize that in situations where a child has just been diagnosed with cancer, or there's some kind of life-threatening health issue, that not taking time off work is actually not a possible choice. I had the experience of taking a kid who was sick to the doctor. The doctor did the pulse ox, said, your kid needs oxygen and you're getting in an ambulance right now, and going to Children's Hospital. Yeah. And at that point, we get in the hospital, and the kid was 15 months old. It was not possible for me to leave him. It's not the nurse's job to do childcare. And so at that point, the choice is, am I going to keep my job, or is my employer going to fire me? It's not, am I going to stay or not? My nephew had pediatric cancer just in the fall, and there was no choice. His mother, of course, had to take time off to take him to chemo, to take him to radiation. And so what happens is that the caregiver, whoever is chosen in the family, does lose the job if the employer doesn't provide the paid time off. And so we see stories of this happen all the time. And it's one of those things that happens somewhat at random. And so, caregiving just lands in our laps sometimes. Mm-hmm. And this is, I think, one of the reasons why a comprehensive paid leave program can have such broad bipartisan support, because there are so many people in this country who relate to the issue, who can say, oh, we just went through that with my mom. Oh, my husband just whatever. And there's so many stories like that. When I talk about the work that I do, invariably that's what happens in the coffee shop, when I'm getting my hair cut, et cetera. People say, oh yeah, we just had this happen in my family. And so I think that this is why we can have this kind of broad bipartisan conversation now. People are experiencing it. We know that when faced with the choice of losing a job or losing a family member, we're never going to choose to lose the family member. And so there's an economic cost that many families are facing, and I think that that's what we need to address as a country. Mm-hmm, mm-hmm.
And on this topic of health, we can even circle right back again to breastfeeding. Having well baby pediatric visits and vaccinations on time, those are good things in terms of helping to keep babies healthy. And so is breastfeeding. I mean, breastfeeding is nutritionally the right thing for babies to be getting, and it also gives them antibodies that are designed specifically to keep them healthy. Breastfed babies are more healthy, and they're less prone to illnesses and sickness. And so by giving families this time for these well baby visits and also time for breastfeeding, you're getting a double hit on this of goodness.
And saving healthcare costs in the process.
Absolutely.
I guess kind of to wrap this up then, because you were just talking about what policies we should support and there being bipartisan support and all that, and there are some proposals kind of making their way through Congress, one of which would allow new parents to draw from their Social Security fund and then delay retirement. Another that we talked about, the Family Act, which works in the similar way as California. Do each of you, kind of as a final question, if you had a specific policy where you would say this is nationally what the next step should be, what would that look like?
I will say I'm very sensitive to something Senator Dodd said, and I appreciated Senator Santorum saying it in a very positive and a kind way, saying that, Democrats take one slice of the apple and they'll come back and take another one. But I think we've taken the slice with paid family leave, and this is the chance to get the whole apple, if you will. We've had, 34 years, if you count when Senator Dodd started this. We have made a significant movement on this, and it's wonderful to see them up here together. I really think that we have to have a comprehensive paid family leave. Again, the statistics, I'll just say them again, we know that over 70% of Americans who take advantage of Family Medical Leave Act take it for medical leave. We don't want to leave those families out. We don't want to leave that type of caregiving outside of the equation. And we also still, of course, need to make sure that babies and parents have time to bond with each other. I will leave it to my esteemed colleague, Jennifer, to speak to the Social Security issue. I will say this one thing, though. We do know that Social Security is women and women of color, low-wage working women are often get the short end of the stick when it comes to Social Security, and so I would be very hesitant to advocate for anything that is going to increase those odds or make those odds worse for families and women in particular.
Exactly. Yeah, I just want to echo that I would have serious concerns about tapping into Social Security, either by having people delay when they can take their retirement, or by reducing the benefit that they would receive in other ways. Because the people who need this paid leave the most are the ones who are most likely to also be relying heavily on Social Security down the road. And are also the ones who are most likely to need to retire earlier rather than later. They're not going to be those who are taking advantage of their higher benefits if you retire when you're 70. They're the folks who are waiting, counting the days until they can finally file for Social Security at 62, 63, 64. And so,
laborsome jobs.
Right, exactly. They're physically grueling jobs. These are folks who have already experienced health disparities across their lives. And so then to ask them to wait because they took time to care for other people in their family who needed the care. It doesn't make sense to me. The other thing is that we have a growing number of households that are not fully prepared for their retirement, who rely exclusively or almost exclusively on Social Security as their main form of retirement income. Right. And we are living longer. Right? And so we're living on that for many more years. And so if anything, we need to be shoring that up and making sure that we all have proper retirement preparation, not thinking about ways to reduce it. One of the things that we know about humans is that unfortunately we're really bad at forecasting our long-term needs. And so we don't do a good job. And I will just say anecdotally, when I was put on hospital bed rest with my twins, I started, as you do, you just read through everything on the internet, and get terrible advice. And so I clicked on this article that said how to afford your twins. And the first bit of advice, I was desperate. The first bit of advice was stop your retirement contributions at work. And as somebody had researched it, of course, I threw my computer across the room. But this is the advice that people are giving, and unfortunately, this is a financial reality that many households face. That whatever money they are putting into savings is something they need to pull back and use for immediate household expenses. And so, asking them to also, at that moment in time, hurt their retirement contributions through Social Security is a really bad idea.
Okay. And I should mention the bill hasn't been introduced yet, but I have been told by Senate aides that it is going to be pretty much that that idea. So we'll see once it comes out.
I'm a little worried about it too. I share all of your concerns. I mean, when I sort of sit back and I appreciate what you said about our collective difficulties forecasting what we're going to need in the future. You know, when I sit back and I just sort of think about the whole idea of funding it through borrowing from one's own Social Security, it sounds a little bit like a predatory lending scheme. You know, it's just like payday lending. You know, and I don't know if that's going to be a wise. I can appreciate the desire to reduce and to delay Social Security payments, and I can understand that there's a fiscal pressure that's regarding that. But to sort of balance that off at the expense of babies and parents, I mean, I'm a little skeptical of that part. If you were asking the question too about you know what the dream policy would be, you know, and I don't know exactly how to best think about the financing for that. There's other people who spend a whole lifetime thinking about financing issues. But one of the things that I would certainly put out there is I would hope that the policy in terms of its nuts and bolts, because in the end, how well this works is going to be issues also of nuts and bolts, is one where we take advantage of the fact that we do have a robust system of health care in the United States. We have prenatal care centers, and if we're going to get word to parents about what they're entitled to in terms of family leave, prenatal clinics is a great place to do that. And it's a great place for them to start the planning on exactly how they're going to be able to utilize that. That at the end of family leave, there's going to be, for many families, childcare needs. And that we need to be engaging also the childcare community. And we also need to be engaging childcare resource and referral agencies that are basically existing programs that are paid for to do exactly that. And so what I would hope is that the attention isn't only placed on the big issues, but also that there's going to be some good thought in terms of exactly how best to implement this and to roll this out so that we can do this in a way that families can understand what they're entitled to and that they can make best use of it. Because in giving a family access to a service that they need isn't really giving them access if they don't know they have it. And we need to think about exactly how to manage that too.
Well, thank you all so much for your time and your expertise. I know that I learned a lot, and it's always exciting for me to hear, you know, even though we talked a little bit about the politics and the policy, but also to hear about the science and what the research is showing us. So thank you all so much for being here.
Kimberly, thank you for leading us through that. Panelists, thank you for being here. For everybody in the audience that was so generous with their time this morning, thank you for spending so much. This is just the beginning of BPC's process. One thing I'd like to note is that we work across the spectrum on a lot of different issues. Paid family leave doesn't really get headlines. As discussed, it's a silent struggle, and there are a lot of different parts. A lot of the end of this conversation was about the child care and infant side. We'll be exploring the medical side, the family side, and having discussions with public and closed door over the course of the next few months, and we welcome engaging you all over time. So please reach out and let us know if you'd like to be involved, and thank you for being here.